Hi, my name is Nur Syafiqah binti Zamawi, and today I will talk about X-ray technology. X-ray technology is discovered by Wilhelm Röntgen in 1895. It is considered a revolutionary breakthrough in medical and healthcare advancements. It marked the beginning of diagnostic imaging and laid the foundation for the field of radiology. Today, X-rays are widely used in hospitals and clinics around the world due to their ability to provide quick, non-invasive internal imaging. This technology plays a critical role across various medical specialties, including orthopedic, dentistry, cardiology, and emergency care. Despite involving ionizing radiation, modern X-ray machines are designed with safety in mind, using controlled doses to minimize risks to patients. Its reliability, speed, and diagnostic accuracy make X-ray one of the most significant tools in modern healthcare. X-ray is one of the earliest and most vital imaging technologies in the medical and healthcare field. It enables non-invasive visualization of internal body structures, particularly bones and organs, making it a crucial tool in modern diagnostics. The significance of X-ray technology lies in its ability to support early diagnosis of conditions such as bone fractures, lung infections, and even tumors. Since the procedure is non-invasive, it allows internal examination without the need for surgery. X-ray also play a key role in guiding treatment, especially during surgeries or while placing medical devices like catheters. Additionally, they are essential in monitoring patient progress, for example, assessing how well a bone is healing or evaluating the improvement of a lung condition. X-ray also known for being fast, cost-effective, and widely available, making them an indispensable tool in clinics and hospitals around the world. The history of X-ray technology began in 1895 when Wilhelm Röntgen discovered X-rays while experimenting with cathode rays. He produced the first X-ray image of his wife's hands, clearly showing her bones and wedding ring. This groundbreaking discovery earned him the first Nobel Prize in Physics in 1901. By the early 90s, X-rays were already being used in medical settings to detect bone fractures and foreign objects in the body. During World War I, X-rays became even more essential, helping doctors locate bullets and fractures in soldiers, which significantly improved surgical outcomes. Initially, the dangers of radiation exposure were not understood, but over time, safety measures such as lead shields and exposure limits were introduced to protect both patients and medical staff. Technological advancements have since transformed X-rays from basic film imaging to digital X-rays, CT scans, fluoroscopy, and even 3D imaging. Today, X-rays are safer, quicker, and more accurate using low radiation techniques that continue to play a critical role in medical diagnostics.
Hi, Assalamualaikum. My name is Anis Farhana binti Mahathir. So today I am going to present about electricity and magnetism concept of X-ray. Okay, so what is electricity? Electricity is the presence and motion of charged particles. And what is magnetism? Magnetism is the force produced by moving electrocharge which cause objects to attract or repel each other through a magnetic field. In a simple words, Electricity can exist without magnetism, but magnetism cannot exist without electricity. Next, let's move to the electromagnetism spectrum and X-ray properties. So, X-ray are part of the electromagnetic spectrum with wavelength ranging from 0.01 nanometer to 10 nanometer. A very high frequencies and high energies. Their ability to penetrate hard and dense materials such as human bones makes them especially useful in medical imaging. Next, X-ray were discovered by Wilhelm C. Roentgen using a Crookes tube, where fast-moving electrons struck a metal target and produced highly penetrating radiation. A modern X-ray machines works on the same principle, using tungsten as the anode and controlled radiation output. This is because X-rays are high-energy ionizing radiation. Excessive exposure can damage body tissues. Therefore, strict safety precautions are followed, and pregnant individuals are advised to avoid X-ray exposure. Let's move to the properties of X-rays. X-rays are part of the electromagnetic spectrum. X-rays have very short wavelengths, very high frequencies, and high energy. Next, X-rays are an ionizing radiation. They can remove electrons from atoms that can damage DNA, which may cause a cell damage. The next one, the properties of X-rays are include of they affect photographic film in the same way as a visible light. They also are strongly absorbed by metal and bone. They also are transmitted through healthy soft tissues. Therefore, these properties makes X-ray are very useful for medical imaging. Okay, so how X-ray are produced? X-rays are generated inside the X-ray machine, also called an X-ray tube, and do not involve any external radioactive materials. A radiographer can adjust the current and voltage settings of the machine to control the properties of the X-ray beam. Different X-ray beam spectra are used depending on the body part being examined. Okay everyone, let's see how an X-ray is produced in an X-ray tube. So on the left diagram, we can see a small increase in the filament voltage labeled as 1 result in a large increase in tube current labeled as 2, which accelerates high-speed electrons from the very high temperature filament negative cathode labeled as 3 within a vacuum towards a positive tungsten target anode labeled as 4. This anode rotates to dissipate heat generated. X-rays are generated within the tungsten anode, and an X-ray beam labeled as 5 is directed towards the patient.
Hello everyone, my name is Nur Alisanin, and I will be presenting this slide, which is about the real-world application of X-ray imaging. First, X-rays are commonly used to detect bone fracture. They can clearly show crack and break in the bone, especially in emergency rooms, bone injuries, and accident cases. Next is the chest X-ray, also known as CXR. It is used to detect lung problems such as pneumonia, tuberculosis, asthma complication, and other infection. Chest X-ray also helps doctor monitor heart size and chest structure. Another important application is dental X-ray. These are used in dental clinic to identify cavities, gum disease, and problems with tooth root. Dentists also use them to plan braces or tooth extraction. X-rays are also useful for abdomen and organ assessment. They can detect kidney stone, digestive tract blockage, or swallow objects, especially in surgical and emergency situations. This slide shows example of X-ray result commonly seen in medical practice. This example highlight how X-ray imaging helps doctor make accurate and quick diagnosis. This slide explains the benefit of X-ray imaging. One major benefit is fast diagnosis result. X-ray can be taken within seconds, which is very important in emergency and trauma cases. Secondly, S3 imaging is a non-invasive procedure. There is no surgery involved and no instrument are inserted into the body because it is a completely external imaging method. Another benefit is that S3 are cost effective. They are cheaper compared to MRI, CT scan or ultrasound, and they can widely available in clinic and hospital. S3 also helps in early detection or disease, allowing doctor to identify condition before symptoms become more severe and improving the success rate of treatment. Finally, S3 machines are highly accessible. Almost every medical center has one, and portable S3 machine can be used in ambulance.
Risk and safety measure of X-ray. First, ALARA principle. All procedures follow ALARA, as low as reasonably achievable, meaning radiation dose is kept as low as possible without compromising diagnostic results. Number 2. Use of shielding. Lead aprons, thyroid shields, and gonad shields protect sensitive organs. Radiographers also use lead barriers or leave the room during exposure. Number 3. Cumulative exposure. Radiation effects are cumulative. Multiple X-rays or CT scans in a short period can increase total dose, especially in patients with chronic conditions. Number 4. Pregnancy risk. The fetus is highly radiosensitive. Exposure during pregnancy, especially in early stages, may increase risk of developmental abnormalities or miscarriage. Future development of X-ray imaging. First, integration with digital health systems. X-ray image will be seamlessly stored, analyzed, and shared through cloud-based medical platforms. Number 2, lower radiation dose technology. Advanced detectors and image processing will produce high-quality images with significantly reduced radiation exposure. Number 3, artificial intelligence AI assists imaging. AI algorithms will improve image interpretations, detect abnormalities earlier, and reduce human error. Lastly, number 4, photon counting X-ray detectors. These detectors improve image contrast and material differentiation while using lower radiation doses. In conclusion, X-ray imaging is an important medical technology that applies principles of electricity and magnetism to diagnose diseases efficiently. It provides fast and non-invasive imaging, making it widely used in hospitals and clinics. Despite the risk of radiation, modern safety measures and technological advancements have made X-ray safer and more effective. In the future, innovations such as AI and portable X-ray machines will further improve healthcare services.